antidepressant isn't working. Before anyone can give you good advice on where to go next, you have to be clear about a few things when you say that your medicines aren't working. Do you mean that they never helped and you're the same as when you started? Or did they start helping and then stopped working at some point? Or did they work some, then kind of plateaued and you haven't gotten any better since? Or were you doing okay but had some big life stressor or change and you're not doing as well as you were? Oftentimes my patients will tell me they feel like their meds aren't helping and then they stop taking them, come off of them, and actually feel worse. So maybe they were helping but didn't realize it until they stopped the medicine. It's also important to have a realistic expectation of what antidepressants will do. Keep in mind that antidepressants aren't happy pills. They treat depression, which then should allow you to do the things you need to do to make you happy. And if life throws you some unexpected surprises, you're still expected to feel normal reactions to those events, such as sadness, anxiety, anger, fear. Antidepressant shouldn't be expected to make you feel that every day is a great day or feel so numb that you can't have normal emotional experiences. Some people tell me that their depression is better, but they still don't have that motivation to do house chores, school, work responsibilities. When I ask if those are things they enjoy doing when they weren't depressed, they tell me no. And my response is no pill's going to make you motivated to do things you simply don't want to do. But if depression is affecting your passion and drive for things that you used to enjoy, then maybe they can help. Sometimes the pharmaceutical companies and doctors can overpromise with what can be expected from an antidepressant. And it's not always about being on the right medicine. You may need more psychological treatments. That would involve seeing the right therapist and getting the right therapy for your problem. You may need to make some lifestyle changes, like changing your diet, increasing exercise, reduce your stress level, get enough sleep, avoiding drugs, alcohol. But let's assume that the medicines really haven't been helping. Maybe they never did much, or helped for a while and plateaued or stopped working. First, have you taken it for long enough? Antidepressants can take 4 to 6 weeks to work and maybe up to 3 months for the full benefit. Or you can try to increase the dose as long as you're not having side effects and it's safe to do so. Studies have shown that most people on antidepressants are not on an adequate dose. One dose doesn't fit all with antidepressants. And if you're on a generic antidepressant, make sure it's a good generic. Not all generics work as well as others or the brand name, despite what your pharmacist or insurance company may tell you. Another option is to switch to a different antidepressant that has a different mechanism of action. Fortunately, we have many different types of antidepressants that work in different ways. That's because all depression isn't the same and all of our bodies aren't the same. Most all antidepressants on the market today work on one of several neurotransmitters or chemicals in the brain. These include serotonin, norepinephrine, and dopamine. Maybe the kind of depression or anxiety you experience requires a medicine or a non-medicine treatment with a completely different mechanism of action. While we usually think of medical treatments for depression as antidepressant pills, there are non-pill treatments other than psychotherapy. For example, some approved antidepressant therapies include transcranial magnetic stimulation, or TMS, or electroconvulsive therapy, ECT, or the more recently approved Spravato, which is related to a commonly used anesthetic medicine, ketamine, which itself has been used off-label for depression for over a decade, but it's not FDA approved for treatment of depression. TMS, ECT, Spravato, ketamine all work very differently from traditional antidepressants and have been shown to help those who haven't benefited from antidepressant medication. There's a host of other medicines on the market that can boost the effects of the antidepressant that you're on if you're getting some but maybe not enough benefit. I have other videos which go into more detail about those therapies. I'd really encourage you to stay informed and make sure whoever's treating you is familiar with these options and that you're real clear with them on exactly what you mean when you say your medicines haven't worked. That will help whoever's treating you to figure out what the next best option is. And most importantly, again, don't depend on someone else to tell you what's out there and what your options are. Be informed and be part of the process to getting better.